are going to talk about the PRP treatment, which is very, very popular for hair loss and to improve hair growth. And it's one of the most safest treatments because it has actually no downtime. You don't have to shave your hair to do it. You can just come, do it, go back to work tomorrow or on the same day. So most people have lots of questions about PRP. I decided I'll discuss about it and clarify your questions. What is PRP? PRP stands for platelet-rich plasma. Our blood is composed of different particles, which is we have RBCs, red blood cell, white blood cells. We have plasma, which contains platelets and other nutrients and growth factors. So what we do is we take about 10 ml, or just like for a full blood count, we take a small sample of your own blood and we process it and we separate the plasma portion, which contains the platelet-rich growth factors. Now there are about 25 to 30 growth factors which really helps to repair the skin, which regenerates tissue, and is really important in orthopedic medicine. We just use it for knee joints. We use it in plastic surgery and cosmetic medicine to grow hair. So it's a nice treatment. Once we take the growth factor or the platelet-rich portion from your blood, we numb your scalp with a numbing cream and then we deposit with a very small needle. It actually feels like a mosquito bite or a small sting. And if you watch the videos of my patients or anyone who gets it done, you're not in excruciating pain. It's actually very tolerable. So we deposit it, and along with it we also give extra biotin and nutrients, which actually helps to grow your hair even more. So we usually do about 3 to 4 treatments. You can read, there's lots of scientific research which proves that platelet-rich plasma really helps to grow hair. Of course, only PRP doesn't help you as much. So you have to take your vitamins at home, you have to follow your home care routine, and you also do your PRP, and we combine it with this amazing hair growth light therapy for best results. So you actually start seeing visible results by the end of the 3rd or the 4th month, and the proper result will be visual or visible after about 6 to 8 months after starting PRP. So whatever the reason that you're losing hair, definitely platelet-rich plasma treatments can help the existing hair get much thicker and to grow more hair. Of course, it's not magic. You won't see results immediately. You will see results after 6 to 8 months, but it definitely helps. How does an ideal treatment go? You walk in, we apply numbing cream, and then the nurses would draw 10 ml of your blood. While the numbing cream works on your scalp, the blood is processed and the growth factor containing platelet-rich plasma is extracted, and the extra biotin and the other nutrients are taken out. And once you're ready, after about 30 minutes, we will be depositing the PRP and the nutrients on your scalp. Then you can do whatever activity, but you can't sweat a lot because we don't want you to sweat the platelet-rich plasma out. You can wash your hair the next day morning. You can do any activity, and if for the very rare few who have a very low pain threshold, you can take 2 paracetamol, which is very comfortable. Side effects. Since we take your own blood, you can never have allergic reaction to your blood. So literally there's no side effects from PRP, which is why it's one of the most safest and the best treatments for hair growth when compared to the other invasive options. Some of you ask us whether the PRP results are permanent. Well, if your hair grows, obviously it has to fall off. That's how the natural hair growth process occurs. Just like a healthy tree would shed leaves every day, and if you look at cats and dogs or any animal would shed fur, if we grow a strand, after its lifetime it will fall off. But actually, if you're noticing hair loss, severe hair loss because of stress or any other reason, and if you're noticing a reduction in your growth, probably because of genetics, probably because of stress or because of lack of nutrients, what we do with PRP is it accelerates the growth speed and it makes the existing hair much stronger so that the growth will be much higher and you'll grow more hair, and the hair which you have will be more stronger, so it will last on your scalp for long. So obviously it's not permanent, but the thing is, if your stress, your job or your personal stress is not going to go away, if your sickness, now some people they take antidepressant tablets, they have thyroid deficiency, they are on medication for that. So if you're on medication which is causing hair loss, if you're constantly coloring your hair, which is a chemical treatment, if you are genetics, if your parents have lost hair prematurely, if your genetics are against a head full of hair, obviously before you lose hair prematurely, PRP will help you retain it for more longer and help you grow your hair faster. So obviously it's not like you put cement and the hair is going to be lasting on your head for long, but it's definitely going to help you prolong a faster loss or prolong balding. Now, another common question is, do we guarantee results? PRP, just go on Google and read scientific medical research, not just journals. Read scientific research. Many papers prove that PRP works, and if not, lots of sports stars or many people won't be doing it, and we have practical examples, lots of examples, more than 1,000 examples of people where PRP actually work. But obviously you have to put in your part. You have to use your home care, your vitamins, your shampoos, your lotions. You have to do your home care properly, 100%. And with the PRP light therapies and the nutrients we add, it really works. According to science, PRP gives about a 75 to 85% success rate. Nothing in medicine is 100%. Obviously, even the most natural process of childbirth, women die during labor or anything. The best antibiotic could work for 9 people, might not be for just one person, So it's not 100% success, or like you can't guarantee, but definitely it has a much higher success rate when compared to your other options like transplant, because transplant has a lower success rate when compared to PRP or any other option. So it definitely is 50-50. You put in your 100%, you do the protocol properly, and unless you have some other issue like severe sickness or severe psoriasis or severe dandruff which is really affecting the results, it really does work.